Okay. This is my first presentation is about exercise order and difference on neuromuscular performance. So the introduction is when we built a resistance training program, we include several variables such as intensity, volume, frequency, rest intervals, velocity, exercise order, and periodized models. So previous research has demonstrated that the importance of varying exercises and load, repetitions and intensity during the resistance training program, aiming to increase muscle cross-section area and maximal strength. To do that, we use multi-joint exercise or single joint exercise. So multiple joint exercise, such as bench press or back squat, require more complex neural responses and considering the high number of muscle, the active muscles. And the single joint exercises, such as triceps push down, have been used to those with low skill and technical skills to target specific muscle groups. When we use these both sequences, or when we integrate both exercises, they significantly affect the several acute training responses. For example, maximal number of repetitions, neuromuscular activity, such as electromyography, neuromuscular fatigue, oxygen consumption, or rating of persisting exertion. So, there are several ways to organize the exercise order. Many of them are related to combining multi and single joint exercises. For example, if we consider the American College of Sports Medicine or NSCA, we will see that several papers consider start the training with the large muscle mass, and after that, small muscle mass. So the scientific literature has focused on primary two different exercise order sequences that we have here. Whole body order, when you use several exercises and try to analyze every one after, before and after each one, or a specific muscle order. For example, traditional, when you use multi-joint and single joint exercise, or the opposite, pre-exhaustion. Then we use the single joint muscle, and after that, the multi-joint muscle. But the main problem of this is the muscle size, because when we use the multi-joint prior versus single joint exercise, we are considering the high muscle size or small muscle size. And the most part of the papers, they consider this kind of idea that there is high muscles and small muscles. But we have considered the high amount of muscle mass involved in each exercise. So we consider high amount of muscle mass and small amount of muscle mass, or the synergism among muscles. This is more important that if the muscle is high or is bigger or smaller. For example, if we consider this paper from by Scott Delph, we will see several muscles here and the size of each one, considering three main parts of the anatomy. For example, average volume, PCSA, or length. Okay, so if we consider that for these both muscles, pectoralis major and triceps, that we use for example in bench press exercise. Bench press exercise, we will see that the triceps is higher in each one of these variables. So this main idea that the size of the muscle is a little bit confusing in our area. So the idea of this presentation is consider the multi-joint or single joint combination, and not if the muscle is bigger or slower or lower. So the pre-exhaustion order is a sequence that involves working out the same muscle or muscle group to the point of neuromuscular failure using a single joint exercise, immediately followed by a related multi-joint exercise. So we are talking about synergism. For example, Gentile investigated the effects of pre-exhaustion sequence using pec deck exercise and bench press at 10 maximal repetitions. The results, they observed similar electromyography amplitude of both the anterior deltoid and pectoralis major muscles. However, an increase in the triceps brachii activation. So we have a differences between among these muscles when you have the pec deck as a first exercise. But the total number of repetitions were not significantly different between sequences. The second study about that, Brenak analyzed the pectoralis major, triceps brachii, and anterior deltoid in the bench press alone, and in a pre-exhaustion sequence, such as pec deck fly and bench press in trained men at 10 maximal repetitions. And they found the same results. The pre-exhaustion sequence did not increase the muscle activation of either pectoralis major or deltoid, anterior deltoid, but did in the triceps brachii. So the main purpose of this study was to measure the acute effects of pre-exhaustion versus traditional exercise order on neuromuscular performance and electromyography, superficial electromyography in trained men. We had in this study 15 subjects, and they were trained. So this is the characteristics of the subjects: 25 years and 1 year of experience in resistance training using these exercises. My experimental procedure, we did just one session. In this session, we had 2 moments. The first moment, we analyzed the maximal load lifted in bench press, in push down triceps separately. And we found the maximal load for each one to 10 maximal repetitions. After that, after 30 minutes, we analyzed the pre-lactate, and each subject did one of these sequences. For example, pre-exhaustion for the second moment, pre-lactate, pre-exhaustion, post-lactate, okay? And rest more 30 minutes, and after that, do the next sequence, for example, traditional, and go on. So this sequence both sequences were randomized, okay, for each subject. So the first moment, we found the maximal load for the both exercises, and we analyzed the maximal voluntary isometric contraction. So for these exercises, we have 260 newtons to the 10 maximal repetitions for triceps push down, and 680 newtons to bench press for 10 maximal repetitions. And at this point, we acquire the MEG signal to normalize each trial during our study. So we did two repetitions of 5 seconds of maximal voluntary isometric contraction, and this a specific position. So we use this position to acquire the EMG data and further and later analyze the data. The second moment, the data acquisition. It was the first exercise order, the pre-exhaustion. So the first we have the triceps push down, and following this exercise, we went to the bench press exercise. And the traditional is the opposite sequence. To control the movement and to define the concentric and eccentric phase, we use an electrogoniometer, and all subjects were instructed to maintain a constant velocity of 2 by 2 seconds by a metronome. So the data acquisition are related to these variables. Maximum number of repetitions to each exercise, volume load, the analysis of the electromyography to pectoralis major and triceps brachii, lactate analysis, and rating of perceived exertion analysis. We have several ANOVAs and the statistical analysis for this, all this data. And I will present the methods and results now. For example, we have here the pre-test where we have 10 repetitions with the maximal load lifted. And after that, we have the both conditions, pre-exhaustion and traditional exercise order. So we can observe that for both orders, we had two repetitions in each one that are missing. So the first exercise, for example, in the pre-exhaustion, the triceps push down, all subjects did 10 repetitions, and in the sequence, in the bench press, they did 8 repetitions. And the same condition happened in traditional condition. So the second analysis was about the volume load that was defined by following formula. The volume load is the maximum repetitions times load. Here we can see that we have differences, significant differences between the pre-exhaustion and pre-test only. But between pre-exhaustion and traditional exercise order, we didn't have any difference. So considering that each lost repetition removes a different value, for example, if we can't do a bench press exercise, we are removing 680 newtons of our training. Or if we are if we remove 2 repetitions, we are removing 260 newtons. So this is a big difference between the volume load of the set. And if we consider that we will do several sets, it will be important. So the bench press was able to present a higher drop when compared to triceps push down, and consequently reducing the total work. To the rating of perceived exertion, we use the same scale, that's Borg, and 30 minutes after each condition, we asked to all subjects how was your workout, and we couldn't observe any difference between them, between any exercise order as well. The lactate analysis, we did the baseline before all sequences, and immediately after each sequence, and 3, 5, and 10 minutes pause each sequence. And we can observe differences between each pause test with the baseline, but we didn't observe any differences between both exercise order. So the last analysis was about the IMG. So the superficial IMG signals of the pectoralis major and triceps brachii were recorded by electromyography with a sample rate of 2,200 hertz and a commercial design software program to that. And all analyses were done by MATLAB. So this is the position of each electrode to the pectoralis major and the lateral triceps brachii, lateral head of the triceps brachii. And the analysis, the data were band-pass filter, and one RMS with 150 milliseconds moving window was calculated during the maximum voluntary contraction and 2 mg data. And the RMS data was then normalized to the RMS average of the 2 peaks of the maximum voluntary contraction. So we calculate the integrate IMG for each sequence and muscle. So here we have a figure, a graph with the 10 repetitions, and the first analysis, we remove the first repetition, and we analyze the 3 following repetitions. So we consider the angle to cut each repetition, and we analyze all of the 3 to 1. So the blue part of the graph. For this analysis, we didn't observe any difference between the both exercise order. So we couldn't see any differences in the motor control of each muscle for each exercise order. In the second analysis, we used the first. We removed the first, so the second repetition, and we removed the last one, and we analyzed the ninth repetition. So we would like to compare the beginning and at the end of each set. So to bench press the pectoralis major, if we consider only the first repetition, we observe that we didn't have any difference between any order. However, if we consider the first and the last repetition, we can observe an increase of the IMG for each one, and we didn't have any differences between exercise order as well. The same pattern to the triceps brachii. So both are important to the bench press. And to the triceps push down, we could observe the same pattern. No differences between the first repetition and an increase of for all conditions for the last repetition compared to the first repetition. So the results. Similar muscle activity for the first repetition in all conditions, as we saw. IMG increased in the last repetition in all conditions, and similar muscle activity response in all conditions. So the conclusions, when we compare the traditional and pre-exhaustion sequence. No worry. Good sound. So when we compare the traditional and pre-exhaustion sequence, we can observe similar volume load and RPA and lactate and muscle activity. And the second, when we consider the second exercise, it presents a reduction in the number of the repetitions in both sequences. And the load can be higher in traditional sequence considering the load lifted. So if we consider a whole train, it could be important. So the non-academic theory, considering that a pre-exhaustion sequence elicits a greater level of neuromuscular recruitment for the non-fatigued fibers and may allow additional repetitions and or volume, did not corroborate with the results of the present study. So the both sequence could be used, but the traditional sequence when the pre-exhaustion the traditional sequence could be worse because the first exercise is the bench press. Thank you.